Many women struggle with pelvic girdle pain during pregnancy, and for some, the pain continues or even starts after birth. This condition is complex, often with multiple contributing factors. Pelvic girdle pain is felt in the sacroiliac joints, behind and/or in the pubic symphysis in front. The pain may also be located in the hips, the groin, or the lower back. The pain can significantly limit daily activity and quality of life. The main goal of treatment is to restore function and reduce discomfort. Every woman's situation is unique, which means support and exercises must be carefully adapted to her needs and abilities. Common challenges include impaired force closure, reduced stability, changes in motor control, and altered movement strategies. To address this, it is important to understand how the body works as one connected system, where muscles, nerves, fascia, and connective tissue influence each other. Weight-bearing exercises is especially effective in training muscles to coordinate, while also reducing shearing forces and making movement less painful. With the Redcord Workstation, I can guide patients through exercises in different positions, adjusting the load with precision. This allows me to take them out of a pain-provoking context and train smaller parts of a movement chain. For example, I can straighten the hip function while lying down if standing is too painful. Good pelvic function relies on the coordinated interplay between the pelvic floor, the abdominal muscles, the lower back, and the diaphragm. For me, it is essential that patients not only train but also gain knowledge and confidence in their own bodies, as they can take ownership of their own recovery. Sometimes additional tools like a pelvic probe or ultrasound can be used as a biofeedback to help patients see and feel how their muscles work together. It helps verify and document the treatment effect. I often compare this process to building a puzzle. When you put the pieces in place, the whole picture becomes clearer.